Now the next thing that we will be studying is about the amyloidosis. What is amyloidosis? Amyloidosis is nothing but a disorder. It is a disorder characterized by extracellular amyloid deposit. Extracellular amyloid deposit. So what basically happens is they disrupt the architectures of the tissue. They disrupt the architecture. Architecture of what? Architecture of tissues. As a result of which, what happens? There is organ dysfunction. Okay. There will be organ dysfunction. Now, let's see what are amyloids. Okay. What are amyloids? What are amyloids? So, amyloids are basically a beta-pleated sheath configuration, and they are formed rigid and insoluble fibrils. Okay. Now, they have a very special stain, as you are able to see in this figure. They have a Congo red stain, and it is very characteristic of amyloid. So, let's just write down that also, that they have a Congo red stain. They have a Congo red stain, which shows what? Which shows the apple green birefringence. Okay. See this figure. This is nothing but the apple green birefringence which the amyloids show. Now, next thing that I want you all to understand is about some of the biochemistry points of amyloids. Okay. So, they have, what are the composition of it? If I talk about the composition, then in the composition, first thing that you have is the fibril protein. First thing that you have is the fibril protein. Next you have is the serum amyloid P component. Okay, it basically stabilizes the deposits that are there in the amyloid. Third you have is the glycosaminoglycans, and you will read about this glycosaminoglycans in your biochemistry lectures in details. Okay. Now, next thing that I want you all to understand is, look at this figure. This I have taken from your Robbins textbook. What you have? You have the folded proteins. Now, what the folded protein do? They have a misfolded protein, as a result of which they convert into the beta-sheeted structures and finally form the fibril. Right? These are basically nothing but the types of amyloids. Okay? These AL, AA and ATTR are nothing but the types of amyloids. Okay? They are nothing but the types of amyloids, right? And now we will look into the types in detail. So we have a classification of amyloids, right? See this table. This will be very clear. You have, on the basis of systemic classification, hereditary classification and the localized amyloids. So on the basis of these three categories, we basically divide the amyloid. First one is the plasma cell perforations with amyloidosis, called as the AL1. Then you have the AA. Then you have the hemodialysis associated. Then you have the familial Mediterranean fever, that is the AA. And then you have the senile cerebral A beta, that is for the Alzheimer's disease. In the endocrine, you have the type 2 diabetes mellitus. So these are basically the abbreviations which you need to keep in mind, right? Now, where were we? We were discussing about the classification. The classification of amyloidosis, right? First we have is the primary. In the primary, what do we have? primary are basically composed of the light chain immunoglobulin. And they are associated with the plasma cell disorders. They are associated with plasma cell disorders. What are the plasma cell disorders that you know? First one is the multiple myeloma. Second one is the monoclonal gamma myopathy. Okay. So this is all about the primary that you have. Next, coming to the secondary one. Okay. I'll just write down here. Second one, secondary. Secondary is also called as the AA type. Secondary is also called as the AA type. In the secondary, what you need to understand? In the secondary, you have basically the chronic inflammatory diseases. The chronic inflammatory diseases. What are they? First one is your rheumatoid arthritis. Okay, first one is your rheumatoid arthritis. Second one is your tuberculosis, and the causative agent of tuberculosis is Mycobacterium tuberculei. Third one is the chronic infection. And the fourth one is the familial Mediterranean fever. Familial Mediterranean fever. Right. So these are basically the types. In the secondary, you mainly have the chronic type. Now, third classification is based on the hereditary or familial. Okay, hereditary or familial. What do you have here? Here you have a mutation. There is basically a mutation in what? In the ATTR gene. There is a mutation in the ATTR gene. In the secondary one, it was in the AA type, and here it is in the ATTR. The examples, if I talk, are the familial amyloid polyneuropathy. Okay. Now, next that we have on our plate is the fourth one, that is dialysis related. That is dialysis related, and it is beta-2 microglobulin. So what happens here is, this basically occurs in the patient who are on a long-term dialysis basis. The patient who are basically having a dialysis for a longer duration of time. So what happens is, the amyloids basically deposits in the joints and the bones. The amyloids deposits in the joints and the bones of that patient, right? Amyloids deposit in the joints and the bones of that patient. Next that you have, fifth one, is your age related. Age related. Because as the age progresses, we start developing certain kind of diseases, right? So what are the age related you have? In the age related, you have the amyloid basically starts depositing. Amyloid start depositing in the heart of the elderly patients, right? Now, let me just give you certain example of the localized amyloids that we have. Amyloids, right? Localized amyloids are basically the amyloids which are specific to that disease. And if you know this amyloid, it will be very easier for you to understand and identify the disease that that person is facing, right? So the first one is, obviously, if we are talking about the senile, the first thing that come to your mind is about the Alzheimer's, right? So you have the Alzheimer's disease, and in the Alzheimer's disease, you have the A beta amyloid. Second you have the medullary carcinoma of thyroid, obviously. Here you have the calcitonin. Now, when we are discussing, I have told you that there are certain specific things which are, very, very specific for that particular thing. Like in the mast cells, I have told you that you need to remember histamine. In the WBC, I have told you the main heroes are neutrophils. Here, in the medullary carcinoma of thyroids, you have to remember the main heroes are calcitonin. Okay. Now, next is how we can forget about our diabetes. So, in the diabetes, you have what type of amyloids? You have the islet amyloid polypeptide. It's seen in which type of diabetes? Type 2 diabetes. And if we are talking about diabetes, how we can forget that you should also know the criteria of diabetes. What are the criteria that I have told you? You need to remember two values. What are the two values? Either 200 and 126. 200 is if the person is doing a random blood sugar. 126 is fasting blood sugar, and HbA1c should be more than or equal to 6.5, right? Now, we have talked about the types of amyloids, right? Now, it's time for us to tell you about the pathogenesis, I guess, right? Pathogenesis. Now, in the pathogenesis, what first happened is the protein misfolding. Protein After the protein misfolding, there is aggregation. And lastly, there is fibril formation. Lastly, there is fibril formation that occurs. Okay, so these are the basic steps which amyloid follows. Now, next one is if there is overproduction. If there is overproduction of amyloids, which leads to the amyloid accumulation. Overproduction basically leads to amyloid accumulation. Now, you know what? Amyloids deposit basically can happen via three mechanisms or via the three pathways. First one is the physical disruption. Physical disruption of normal structure. If there is physical disruption of the normal structure is there, then amyloid deposit can occur. Second one is if there is a process of apoptosis. Third one is if there is a impairing nutrient diffusion. So these are basically the three things via which the amyloid deposits can occur. Now, I want you all to make a table with me. That will be very, very helpful for you at the end, right? Here we will write the organs which are affected and the clinical effect, right? So this table will be very, very helpful for you at the end. So here you have the organs and here you have the clinical effect. Organs and the clinical effect, right? The first one that you have is obviously the kidney. In the kidney, what you have? The effect is nephrotic syndrome. Nephrotic syndrome, and we will read about the nephrotic syndrome when we will be covering the kidney portion, right? Because nephrotic syndrome is very, very important in there. Then in the heart, what you have is the restrictive cardiomyopathy. Restrictive cardiomyopathy. Next that we have is the liver, and in the liver we all know very famous hepatomegaly. Next organ that you have in the spleen, we all know only two things: either the spleen is ruptured or either the spleen is enlarged. So here we have the enlarged one. Next we have the nervous system. In the nervous system you have the peripheral neuropathy. In the nervous system you have the peripheral neuropathy. Sixth one and the last one is the GI tract. In the GI tract, what you expect? Either the malabsorption or either the bleeding, right? So these are basically the organs and the clinical effect that they have when there is amyloid deposits in that organ. So you need to understand this table very well, because it will be very essential for you at the end of the, when only 1 or 2 days are left for university exam. This table you need to remember. I am just marking it a star. Okay, now next let's just talk about the clinical features. So what are the clinical features? You know, see, I have told you to make a journalized table for all the clinical features, right? I hope you are making it. So in the clinical features, first thing you have is the, in the renal system, you have what? Proteinuria. Then you have the edema and then the renal failure. In the cardiac one, you have the heart failure and the arrhythmia. Third one, in the neuropathy, you have the numbness, and weakness that you are able to see. Now let's see some of the journal clinical features that you have. In the journal clinical features, we have, first one is the fatigue will be there. Okay, then there will be a weight loss. Then there will be enlarged organs and hypotension will be there, and hypotension. And since you are clinicians, you have to tell me what is the treatment of hypotension you will give. Tell me the treatment of hypotension now, and also tell me which criteria are we following for hypertension right now. Is it the 120/81, or there is an update in the criteria that you have to tell me? Please go and study that. Okay. Now we have talked about the clinical features. Let's see now how we will diagnose that, right? Because diagnosis is our main street of treatment. If we are not able to diagnose, then we are not good clinicians, I guess. So for the diagnosis, I have already told you, you have a very famous and a very special stain called as the name, by the name of Congo red stain. Congo red stain, and it gives what? It gives apple green Birefringence. Okay, next that you have is by the immunohistochemistry, is by the immunohistochemistry. And then you can identify the types, like the types that I have told you, AL, AA and the ATTR, right? So these are basically how you can diagnose. Other things that you have for the diagnosis, you also have something called as a electron microscope. In the electron microscopy, you will see the non-branching fibrils. Okay, you will see the non-branching fibrils. Imaging techniques. In the imaging techniques part, you are able to see, when you do the MRI, you are able to see the organ involvement. like in the MRI, you will be able to differentiate that which organ is involved, because the organ that is involved, now there will be a lot of amyloid deposits in that organ which you will be able to see. Next, coming to what are the complications it has, right? What are the complications? So the first complication that it has, we have talked about that in the starting only, is the organ failure. Second one is the thrombosis and bleeding. And third one is the malnutrition. So organ failure, I have told you why the organ failure will happen, because there is lot of amyloid deposit in that organ and the organ is not able to function properly. Now, why there is malnutrition? Because if the organ is only affected, then how will the nutrients be getting absorbed into the body, right? So that is why there is malnutrition. What is the treatment that you can give? See, the treatment plan basically depends on the type of amyloid that you are dealing with. Treatment, okay. Treatment depends on the type of amyloid that you are dealing with. The first treatment that you will give is for primary. Okay, let's talk about the primary one first. Primary is of AL type. So you will give the chemotherapy. You will give the chemotherapy. And also you will give the autologous stem cell transplant. Okay, either you will give the chemotherapy or either you will give the autologous stem cell transplant. Now, coming to the secondary one. So, in the secondary one now, the treatment mainly depends on the type of disease we are dealing with in the secondary one. So, in the secondary one, the treatment basically depends on the disease. Depends on the type of disease. Like if it is a case of tuberculosis, then you will start the anti-tuberculosis drugs, right? Next, for the hereditary one, third one, for the hereditary one, what you will do? You will do the liver transplant. You will do the liver transplant. And also, what is the supportive care you will give to the patient? If the patient is on dialysis, see, you will ask the patient to take adequate amount of nutrients. You will ask the patient to take adequate amount of fluids. So this is basically a journal treatment which you all should know. And if a patient is having heart failure, you will start them with diuretic. See, I am not discussing about the pharmacology part. In the pharmacology part, you will learn so beautifully over there about the drug and all the stuff. If the patient is having renal failure, then you will start him on dialysis. This is just a basic thing which I am trying to tell you, right? This was all about the amyloidosis. Now it's time for us to make a summary table, because summary table are so important, and at the last of one day before the exam, you have to read this summary tables only. So we'll make the summary table together. Amyloid, wait, let me just write here. Summary table, okay. Yeah. First thing, amyloids are misfolded proteins. Amyloids are misfolded proteins. See, we will only write the keywords. Then beta sheet structure, Congo red stain, types. What are the types we had? Primary, that was the AL type. Then you have the secondary, the AA type. These are basically the most common one. Then you have a certain generalized clinical features for them that we are not writing. Diagnosis basically based on the biopsy and special stains. Next, treatment is, mainstay of treatment is basically managing the organ dysfunction. Mainstay of treatment is managing the organ dysfunction. So I have a question for you all, and the question is that tell me which stain is used for amyloidosis. You have 2 seconds to think. Which stain we use for amyloidosis? So the stain that we use is Congo red stain. Congo red stain, and it gives the apple bifringes. Okay, apple green bifringes. So this was all about the amyloidosis part, and we are done with the secondary disorders as well.